Dr. Calvin Sun. He's an emergency attending physician at various emergency departments, including Mount Sinai Hospital in New York. And Calvin, I first want to ask you, what are the medical risks that Donald Trump is possibly taken by holding this event 9 days since his diagnosis?
And plenty of risks. He can give it to anyone he comes in contact with, literally from leaving his bedroom all the way to get to the balcony of the White House. Like anything that it breaks any idea of quarantine is elevated risk. But it now looks like someone feels that they have nothing left to lose, so they might as well just bring everyone down with them. And they rather feel like they did more than nothing at all. And that's what it is. Anytime you do something, you have to own the consequences of your actions, and they're taking those risks, and they have to take responsibility whoever they give it to and whatever happens.
Well, Trump said he feels great. He looked fine, but we know that COVID-19 isn't just about appearances and symptoms. Obviously, the drugs can help suppress those. It's about viral loads. So how might that be different than what he's sort of positioning himself as?
I mean, I don't see anything different. He has a huge viral load in him that necessitated him to go get on a helicopter. I don't know when was the last time you and I got the privilege of a helicopter to a hospital. I've sent the patients on helicopters before, actually, and those are people that are about to die. He had the ability to go on a helicopter to a hospital, to the presidential suite room in the Walter Reed Hospital, where he got the literally top of the line, pushing the envelope of medicine that had to be cleared by compassionate care of the FDA. Those medicines usually given to the people at ICU level where there's nothing else left to lose. And now he's trying, those medications suggest he has high viral loads. And while they may suppress it, viral loads have a course, and they can either get better or worse. Maybe nothing will happen. It's just that he's not within that time frame where he's safe to go. He's within the time frame where he's not safe to go, as declared by his own CDC. The first 10 days of symptoms, or since your first day of symptoms, you should not be literally seeing the light of day. Unless you want to infect other people. After that, if you're mildly sick, you may be clear after 10 days. But if you're at the ICU level, which he was, given the medications he got, it has to be at least 25 days.
And Calvin, we saw the images there from the White House South Lawn. The White House says CDC guidelines, health guidelines were being followed. We saw people wearing masks, but not that 2-meter distance that's required.
Yeah, it's like, whatever you want to add on, you add on the risk. If you want to put on a mask, you decrease the risk. And you want to distance, you decrease more of that risk. It's not a black and white. It's these scales are great. But everyone that you add on in terms of the number of people in the lawn, you're adding on different kind of risks that you cannot control for. Variables in terms of different medical history, different viral loads each person has, different exposure experiences that everyone has. The more you people that you pack on in a small amount of space, you're increasing, maybe unnecessarily, a level of variables that may be harder and harder to control. So great that they have masks, that's one thing, but there's also an aspect of, are they distant enough? And if you're not, then you're just adding on more variables of risk.
Calvin, how significant is it that we still don't have confirmation of a negative test from the president?
Yeah, that speaks for the entirety of the response to the pandemic in the last 6 months. It's not about what they've said, it's what they've not said. It's the lack of information that left us dying in March and April in New York City, not knowing where the tests were going, where the tests were coming, where are the tests for the first literally 3-4 weeks in New York City when the virus hit us. And that killed a lot of people unnecessarily, that endangered our lives. You have dead healthcare workers. And I think it's a pattern of behavior and habits. It's hard to break those bad habits when you're not telling us information that may affect us or the people that come to the event. So, I mean, I'm far away from DC, I'm not at the event, so to me, a negative or positive test personally may not affect me. What about the people going to that event? I think they should know that when they're going to see someone and getting up closer, just increasing that risk. Maybe they're far away enough, maybe they have a chance to see him and shake his hand. Like, you're just increasing that level of risk without knowing for sure what his negative test is. And it doesn't even matter if his test was negative. We know these tests have a high false negative rate. It's a 80% specificity. That means a 20% chance that a positive test is wrong, and a 70% sensitivity, which is a 30% chance your negative test is wrong. So it's higher if it's a negative test, because the pretest probability that he has COVID, he might need 2 negative tests for me to really trust the fact that he's in the clear. But really, CDC says that negative tests or not, 25 days if you're ICU level, 10 days if you have any sort of a COVID infection. Doesn't matter what the test says.
All right, Dr. Calvin Soon, thank you as always for your insight.